coordinator at the School-Based Health Alliance. And I'm excited to get us started today. Welcome to our webinar, Hunger Ends Here, Exploring the Continuum of Food Security Programs in School-Based Health Centers. As some quick reminders to get us started, all attendees are going to be in listen-only mode. If you have questions throughout the session, please use the Q&A function you'll find at the bottom of your screen there. And as you ask the question, if you could say who you're directing it to. We have a couple of guest presenters today. And if you want them to specifically answer your question, feel free to just drop their name in the question as well. Your chat will be disabled, but we will be dropping links to resources throughout and events throughout kind of the presentation, so definitely keep an eye on those. If you would like to use closed captioning, feel free to click the CC button. And then we just have some quick evaluation poll questions that we will pose to you at the end. And some objectives to get us started. By the end of the webinar, you'll be able to understand the range of interventions from SNAP outreach to establishing on-site food resources and how they can be tailored to your specific settings. You'll learn more about screening workflows and how to connect individuals to appropriate resources, leveraging existing tools and referral platforms. And then lastly, you'll be able to explore strategies for developing strong partnerships and youth centers initiatives to implement sustainable food security programs within your communities. Awesome. And with that, I am going to pass it over to my guest presenters, Addie and Sarah.
Thanks, Harper. So hi, everyone. Thank you so much for being here. My name is Addie Vanswall, and I'm a director here at the School-Based Health Alliance. I do anything and everything related to food insecurity as well as mental health. So here and happy to facilitate this conversation today with my colleague, Sarah. So Sarah, do you want to give a brief introduction?
Sure. Hi, everyone. It's a pleasure to be here. My name is Sarah Mills. I'm a senior manager on the health systems team at Share Our Strength. Been working with the National School-Based Health Alliance for almost 3 years now, working on food security initiatives with school-based health centers. So yeah, really excited to be here with all of our presenters.
All right, so we also have a number of folks from the field. So if my other guest presenters, Jen, Rebecca, Velda, Lexi, and Kristen, if you want to just give a hand wave, that would be greatly appreciated. You will hear more about their work throughout the rest of our presentation. So in case you are not familiar with the School-Based Health Alliance, we are the national voice for school-based healthcare, and we work to improve the health of children and youth by advocating and advancing school-based healthcare. So we have been working, like Sarah had mentioned, with Share Our Strength's No Kid Hungry campaign for the last 3 years to really help integrate food security programming into school-based health centers.
And for those of you who aren't familiar with our organization, Share Our Strength is a national nonprofit dedicated to ending hunger and poverty for children and their families. Share Our Strength created the No Kid Hungry campaign to really make sure that every child in the US gets access to the healthy foods that they need to thrive and strengthen state and federal meal programs that children depend on. We work across all 50 states with organizations by providing grant funds, advocating for policy change, conducting research, providing technical assistance, and support with all types of organizations, schools, state agencies, nonprofits, healthcare organizations in their work to end childhood hunger.
So the last several years, we had worked on a number of things with No Kid Hungry, the first being launching a national learning network of school-based health centers. Last year, we focused a lot on state support. So focusing, we worked with Colorado and Ohio to implement their own state learning networks, which was really amazing to see them really thrive and launch those networks. So this year we're continuing to work with both Ohio and Colorado to expand their work with the focus on evaluation and sustainability. We're also launching a national survey to learn more about what school-based health centers are doing across the country about food security. So definitely more details to come soon. And then another part of our work is really looking at this webinar series. So we had the first one about a month ago, Bridging Health and Nutrition, Food Assistant Strategies for School-Based Health Centers. That is archived on our website, and we can share the link for that in the chat. Today, we are really exploring a continuum resource that we built out, and we'll be hearing from several different partners about how they have been able to do that work. And then our last webinar in this series is going to focus on the intersection of mental health and food. So we are super excited about that. So make sure you save the date for March 6th.
So we are really thrilled to spend our time today talking about this new resource that Addie mentioned. It's really has been built based on the learnings from our previous cohorts of school-based health center grantees. And it's really designed to complement the toolkit that was released a couple of years ago. We know that school-based health centers are addressing food insecurity using a really wide range of interventions. But each of the intervention really requires different levels of staff capacity, funding, partnership development, and have different opportunities for youth engagement. And so, we've heard from the field that SBHCs would really appreciate more support in understanding where to start when addressing social needs like food insecurity, what are the different opportunities, or maybe they are providing one level of support, like providing a referral to a local resource, but they want to understand what it would take to do more to support families in accessing healthy food. So we are really hoping that this resource can be a starting point to understand, what is that range of possible interventions, and then match an intervention to your specific community needs, and the resources and the capacity that your school-based health center has. So we're going to touch on each of these components of the continuum today. And like Addie said, we'll hear from speakers on the ground who have implemented these different interventions and hear more about their experience.
Okay, so I placed the link in the chat for the Food Continuum resource, so be sure to check that out on our website. So we're going to start out with kind of a breakdown of each section of that continuum, and then we'll hear from somebody from the field who can dive a little bit deeper. So the first one is the SNAP outreach. And this is probably one of the lowest level in terms of staff capacity that it requires, as well as cost. So basically, this is really just highlighting and sharing information and resources with families about SNAP and other federal nutrition programs, as well as being able to provide a link to an eligibility screener, which we'll share on the next slide. And really the best practice here is to partner with your local SNAP assistance organizations to provide follow-up application support. And also it's important to check on if your state has a preferred eligibility screener. Like many things, everything kind of varies state by state, but I think kind of knowing what works well and what works best in your state is really helpful when you're trying to refer students and their families to these programs. With partnerships, it's not necessarily required, but it could be helpful. So I know that when I worked in a school-based health center, I had a particular contact at our WIC office. And so I would have my students do the initial outreach. And if they were having trouble with getting in touch with their program, they would reach back out to me, and then I was able to kind of make that direct connection or warm handoff with the WIC office. So partnerships are really helpful when you can have them. And then in terms of youth engagement, really there could be a lot of ways that you can engage youth, and we'll kind of point out different ways in each of these sections. But you could have youth help with designing a flyer, or you could maybe have them hang them up in the school or determine where the best place they might be to hang them. So we do have a couple resources on this slide as well for a little bit more information. If you want to go to the next slide, we actually have some outreach flyers. So if you are interested in receiving a copy of these flyers, I will drop a link in the chat. This is really from our last webinar, but wanted to share the resource again, where if you're interested, you can fill out the resource referral form, and then we will give you an individualized link for your specific school-based health center. And then we'll be able to kind of track and see how many students and families are using that research or that flyer. And it is available both in English and in Spanish. Sarah, I'll pass it back to you.
Thanks, Addie. So the next intervention on the continuum is developing a resource list to provide to patients and their families. This is another kind of relatively low capacity intervention, but like Addie mentioned, it can be more successful if there are partnerships developed with the community resources. Having those kinds of relationships can help to keep the information up to date that you're providing to families, and also can help with establishing those warm handoffs. With a food resource list, there's also opportunities to partner with your school to ensure that those resources are available to all students, and a lot of opportunity for youth engagement as well. Youth can help to identify different resources available in the community and keep information up to date. So I am going to actually hand it over to Jen to talk a little bit more about the resource list that they developed.
Thank you so much, and thank you for having us. HealthSource was invited via the Ohio Safety Net Alliance since we were part of their Food Access Innovation and Learning Network. So for those who are not familiar with us, we are the largest federally qualified health center in the state of Ohio. We serve an 8-county service area that spans mostly rural Southwest Ohio. And so we see a lot of different needs and a lot of different barriers based on where our patients and our offices are located. I am on the marketing and development team, and it is our responsibility to conduct our community needs assessments, build partnerships within our communities, and that can bridge those gaps and those barriers for those community needs. So I have an incredible team that has helped with this along the way. But when we identify those needs, we then quickly try to figure out what programs we need to establish to intervene. And with that, we have our HealthSource Foundation and what we call our More Than Medicine programs. So one of those programs is our Hunger as a Health Issue. We also address transportation or prescription assistance, but today we'll definitely talk about hunger as a health issue. And you can see on the slide that I have a picture of what we call a kitchen kit. And this is a meal of every ingredient they need to complete this meal for a family of 4 in their home. When a patient comes in for their visit, we screen them on transportation and food insecurity, and if they identify as food insecure, we're able to provide them with this kitchen kit. It's a great intervention, but it's not meant to be, a kind of residual food pantry. We want to then connect them to the next best resource for food security and for food intervention. So we're able to provide them something there, but then how do we connect them with the next step, the next resource? And for years, we had developed a giant booklet, if you can imagine, of every resource that lived in 8 counties. And it was time consuming, it was expensive to print, and then as soon as we would print it, it would go completely just be obsolete. Things would shift or move or even go out of business, as they sometimes do in social service agencies and nonprofits. So my team was tasked with how do we combat this? How do we address this? And we kind of came up with what I'm going to share with you today, which is our community resource map. But that's a part of a much bigger picture of how we like to wrap around our patients and the needs that they face. So just some background, we do provide over 1,000 kitchen kits per year since 2018 when we established the Hunger as a Health Issue program. So, impacting 1,000 patients per year is really incredible. And we know that they're utilizing other resources because oftentimes if they're needing food assistance, there's other issues that they need to address. So we realize that we can't be everything for everyone. So we do like to provide resources that are beyond just food insecurity and address kind of all issues that patients might face that might hinder them making health decisions in the future. And I would be remiss without calling out my incredible team. This is an issue or intervention that might not be expensive, but it is time consuming and needs lots of hands and lots of minds to really address different barriers that we face and different technologies that we've utilized to implement this. So we have a wonderful outreach and enrollment team that is definitely boots on the ground, making connections with community members, community organizations. They also assist with those SNAP enrollments. So that's a wonderful resource to have on hand. The marketing and development team as a whole, we write grants that help fund these programs, do all of our marketing materials, post about different programs or events that we're hosting that'll help with food insecurity. Our care management team who works directly with our patients. And oftentimes, even if those patients don't screen as food insecure, they're discussing things with their care management team who are really diving down to what the root cause might be for some of these chronic issues and some of these things that our patients are facing. And our decision support team who is helping us track and monitor our progress and requiring reports for grantees, grantors, and really helping us improve the system along the way. All right, and you can see on here, we have our slides. We have that kind of call out. That's a card that we put in the front pocket of every meal kit that goes to our patients. And we also have them available in all of our offices and take them to events. But what you can do is when you scan that QR code, it's going to take you to this community resource map. This is a Google map that has every resource that our team has brought together. We have it divided out by different categories. That's something that we work with our care team, our clinical staff to really figure out where things need to be and what issues are most predominant for our patients. And you can see they have different icons for the different things, for what they represent. But you can dive in by clicking the icon on the map or by looking at the key that's on the left on that website. And I believe that they'll probably be sharing a link here soon for that. But you can see you can go to food insecurity. It's then going to drop down every food resource that we have. And then when you click on a specific food resource, you can do that by vicinity to yourself or by recognition of the organization. And then it's going to give you all the information and hopefully a website that you can access or a phone number where you can call. So this has been something that's heavily utilized not only by our staff, but by our patients. It's public facing on our website, which is wonderful. But it's been a really great way to address the multitude of needs that our patients face. It's been used by other social service agencies. We have Safety Net Alliance, the Ohio Safety Net Alliance here in Claremont and Adams and Brown counties. They utilize this map heavily to connect people with other resources. And it's just been a really great thing to see come to fruition. It's helped us with, removing that paper, those paper resource guides that go out of date quickly. And it's helped us really,
Check your network settings.
oh, I'm sorry. My phone I must have triggered something on my phone. But it can really be a resource for multiple entities, whether it's in-house at HealthSource or with one of our partner agencies, and even our patients directly. So I just want to share some things to consider when you're doing this. Is you don't have to recreate the wheel. We at HealthSource, we are the trusted entity many times, but we know we can't be everything to everyone. So how can we best connect our patients to other area resources that we know they're doing things well? They're already an expert in their field, they're an expert in their interventions. How do we get them connected to our patients directly? And we have found this to be our best way to do that. We do have a very robust team, and I can say they have talents that go beyond just the numbers. We have an outreach and enrollment team of 6 who really are making those connections. They actually input all of their connections into a spreadsheet that we can then upload to this Google map. They highlight all of the services that those entities provide, and really are just our wealth of information for us. And then we have a marketing and development team. There are 4 of us that really work directly with our community needs assessment and community impact, or community resource map. So we're constantly trying to improve and streamline this process as much as possible. One of the things we want to be very conscious of is how often we are updating this, and how we are doing so. So make sure that this information always stays up to date and is always accessible for our patients, and not just an extra barrier, extra roadblock for them. So we conduct this biannually. We actually do this via email, or that has a link to a survey, or we always make it clear that service agencies can connect with us directly via email, and we will make those updates as quickly as possible. Another thing to consider is within the Google Maps, you're only able to do 10 categories at a time. So we have to be very conscious of how we're organizing these. So one, it's very user-friendly that all reading levels, all patient levels, since we are dealing with school-based health children as well, as this webinar is discussing, has to be accessible for everyone. So being very conscious of how we're organizing these, how we're labeling them and getting them out there, very important. And then just also that information is limited. You can only provide so much within this space. So making sure that you encourage folks to contact or call first. So if there are eligibility requirements, they're not showing up to a resource unprepared. Encouraging them to check out hours of operations. Have things changed? Do they have certain winter hours? Are they only doing food distributions on specific days? That's not something we can necessarily put in here, and that's stuff that changes on a dime. So really communicating that that's something that we want patients to do is reach out before connecting directly. So those are just a few of the things we provide with our resource map. It has been a game changer for us, and we're seeing about 3,000 clicks per month on our website of people accessing this. So we know that it's going beyond just the kitchen kits. Our care management team is accessing it on a regular basis. Our community partners are utilizing it, and it's been something that's gone from just something in-house to something that we're hoping is a regional approach for us and our community partners to address the needs of our patients and our community members. So thank you guys so much for having me. I'm happy to answer any questions and talk to you about how you could maybe adapt this for your organization as well.
Thank you so much. I'm always really impressed when I hear about all of that work, because it's just so awesome to have something live and accessible and very user friendly. So definitely appreciate that. We're going to move on to the next one. I do see some Q&A in the chat, so we will do our best to answer those questions. We may choose to answer some of them live, but we will kind of continue to monitor that as things go on. So the next one we're going to talk about is the food security screening and referral. And this is where things get a little bit more complicated in some ways. So in terms of staff capacity, it could be something that is particularly requires a lot of capacity at the beginning to kind of start if you're thinking about establishing a new workflow, if you're figuring out how you're going to document it in your electronic medical record, and then how you're going to follow up and really track those referrals. That's where things tend to get a little bit tricky. And as far as cost, it can really, we have $2 signs here. It really kind of depends on your EHR. So if your EHR already has something built in, that that's great. But if you have to build out a whole new system, that can be quite costly. And so just really kind of trying to do what you can to maybe adapt the resources or use what's available to you so you're not running into kind of a high cost intervention. In terms of partnerships, this really is when you're talking about it's, the school-based health center staff can do the food security screening. But when it comes to that referral piece, it's really important that you do kind of have those warm handoffs or build relationships. So whether that's a warm handoff to somebody else in your school-based health center, so if it's a medical provider doing the screening and then you hand off to the social worker, or if it's the medical provider doing the screening and then referring to a community-based partner, having those kind of direct lines of communication in terms of who to call when you call the food bank or when you go or where you go. So making sure that you're really kind of building up those partnerships. We suggest that your food security screening is something that you're doing on a regular basis, and that it is something that is provided in your EHR. There are a number of screening tools, as well as a case study from the Youth Healthcare Alliance that will kind of help provide some additional information and resources. And then as far as youth engagement, they often are not able to directly help with the actual screening process, but they could provide some patient feedback or experience around what it was like talking about food security or what the process could be like in a school-based health center. So really kind of keeping youth at the forefront, recognizing there may be some limitations here, but also still keeping them engaged. So with that, I believe I'm going to pass things over to Rebecca to talk a little bit more about what they were able to accomplish in Colorado.
Hi, thank you for that, Addie. We are the school-based health center membership organization in Colorado, and we have been able to support this work in Colorado's school-based health clinics, headed into a second year. So to give you an overview of where this fits into the screening and referral process as a state affiliate, in year one of the work, we worked with 10 clinics across the state, really on this topic about how they were going to bring a routine screening and referral system into their clinics. And what that looked like depended on the clinic, their existing workflows, and their community and the resources within it. So we got to see how this looks from a federally qualified health center standpoint to a small lookalike clinic in rural settings, urban settings. It really gave us a great perspective of where this work might fit and how it needs to be adapted. What we are doing in a second year is saying we've learned a lot. Now let's take that one step further and figure out how this can fit into more school-based clinics. It does bring up some challenges. I think you heard about several of them. The data collection piece is really tricky. It's one thing to do it, it's another thing to track it. So we're still working out the most efficient ways to do that and how to make sense of it so that you can really understand what is being effective as far as reaching the majority of your patients, making it routine, and ensuring that those referrals do end up connecting. So that part is, I would say, on on just the challenges, probably one of the bigger ones, especially closing the loop on referrals. The other one that's been challenging is on a human level. Food is a very sensitive topic, and making it a comfortable and okay place of discussion for patients and families to screen and to accept support is its own challenge. And then there's also, when you're working with school-based health centers, sometimes you have families present, and sometimes you just have a youth present. So those are all aspects that we've been working through. The things that we've seen work really well are that the clinics doing this work have really succeeded in making it something that happens with all their patients, that it's sustainable, youth are involved in it, and that they have increased their partnerships with others throughout their community and the state. So a few things on the next slide that really speak to the success of what we see are very similar to what you just heard. Don't reinvent the wheel. So use existing processes. Most school-based health centers have screening tools for other concerns that they do and have a routine process for that. So embedding screening for food security needs into those workflows has been a really useful starting point for many of the clinics. Whether that is screening for other social drivers of health or for mental health issues or for other physical health concerns, this has provided a platform for finding those processes. And so within that, also making it routine. So this isn't about calling out a specific subgroup of patients. This is something that the clinic does universally. And in doing so, that really helps normalize food as part of health. So it becomes the same as asking about, your hearing, your vision, all those other things you screen for, your oral health, you're screening for food, you're screening for mental health. It just becomes part of the process. And then recognizing that the sensitivity of food is also often tied to the fact that food is a very cultural and personal experience, and that the underpinnings of food insecurity can be linked to things outside of a person's control. So having a trauma-informed, culturally aware communication when you are talking about food concerns with patients is really important. And then on top of that, really tuning in to what already exists for the school and community as far as resources for your referral, in addition to using SNAP and WIC as referral sources as well. So what you'll see on the other side of this slide is a sample workflow. This is based on using hunger vital signs, and what we did with this workflow was included it into a system that already exists for screening tools for other conditions within Colorado's state school-based health center system. So really using that existing process and then adapting it so that it is inclusive of screening for food security. So what we have found in this process is that it's really important that you check what the responses are, and then talk with the patient one-on-one to make sure that what they put in the screening is reflective of their experience. So sometimes what they're comfortable discussing is different than what they were comfortable writing on paper. Or if you get a youth self-report, sometimes their version of not having enough food isn't the same as there not being food in the house. So it's really important to bring that personal element in and check that, and then to be able to document what you did in response. And that builds in the tracking piece that is really helpful for closing the loop to referrals down the road. So I'm going to stop there. Thanks.
Thank you, Rebecca. So kind of picking up where Rebecca just left off, the next kind of stage in this continuum is, providing that follow-up, either resource navigation or application assistance for families. So like has been mentioned, school-based health centers might already have workflows in place for providing screenings and offering referrals to outside organizations. But being able to provide kind of that in-house support for follow-up can really make the difference of families being able to be connected to the programs that they're eligible for or the services that are available. And also then to be able to know as a school-based health center that you can close that loop and that the family did get access to that resource. So, just acknowledging that, particularly in the school-based health center setting, that can be really challenging given, what Rebecca mentioned, that screening might be happening with youth and being able to make that connection with the parent or caregiver to make sure that the resource is accessed can be certainly a challenge. But if there's opportunities for you to provide that follow-up, it can be really impactful. And there's a lot of different opportunities that our school-based health centers that have been a part of our cohorts have identified to be able to support the follow-up. So just a couple of quick examples. Actually, in Colorado, there are school-based health centers that receive training from their SNAP application assistance organization. So many food banks provide application assistance for families to fill out their SNAP applications. And they also provide training to other community organizations so that there's more capacity to support families. So school-based health center staff were trained to be able to support that process. And that can be really important for families who already have a level of trust with the school-based health center or the staff there. And the fact that the school-based health center staff can answer questions about the process really just makes it easier for families to move through that. Another example, and I think Jennifer touched on this too, is connecting families who might be eligible for SNAP to enrollment specialists within your sponsor organization. So enrollment specialists might be able to support both Medicaid and SNAP applications for families, and kind of keeping that referral in-house again kind of helps prevent families from getting lost in that external referral process. And then lastly, of course, CHWs are such an important resource for providing resource navigation. And so some of the school-based health centers that we have worked with have found that community health workers or care coordinators or patient navigators that were available or employed through their sponsor organization were able to receive referrals from their SBHC to help families navigate to different food resources. And then because it was within their organization, they had a better opportunity to understand if that connection was made to that resource. So a lot of opportunity there, but again, recognizing that there are some definite challenges in making that connection to the families for that resource navigation. And I think I'm going to hand it over to Addie.
Awesome. Thank you, Sarah. So kind of the next step from there is establishing actual food access programs on site. And so the next two slides are going to talk about kind of two different ways. So this first one is really focused on the school or partner sponsored resources. And so depending on your schools and districts, you may already be connected with your food directors and understand what the lunch programs or after school programs may look like in terms of free and reduced lunch and or summer meal programming. That is certainly something that you should be aware of in your particular schools. But it's also other things like mobile food pantries, food closets, food pantries, weekend backpack programs. These are all things that could be run by the school itself. So depending on where you're located and the resources in your specific community. I know I worked with a community organization who had a Veggie RX program, and they provided kind of free or reduced cost fresh produce on the weekends. And so as long as they had that, referral from the school-based health center, they would be able to access that. And even if they didn't, if they received Medicaid, they would automatically be eligible for reduced cost fresh produce in the community. So making sure that you have those kind of resources available. But this one is pretty intensive in terms of those partnerships with the school or the community-based organization. There's a lot that goes into it in terms of coordination, making referrals, and then really figuring out what is working well for the students and their families. So there have been some school-based health centers that we've worked with over the years that work directly with youth on filling up backpacks. And so that's part of their, volunteer work and experience where they are given information from the school-based health centers, de-identified, so they're not knowing who the food is going to, but they are able to help pack and organize those backpacks before they go home. So that has been a really great opportunity for youth to be involved. So if you go to the next slide, what's probably the highest cost and highest capacity for school-based health centers is to really launch and do your own food access program. So this again could be something like the food pantry, gardens, nutrition and education classes. So anything that's requiring additional kind of resources in terms of time and staff capacity, as well as the dollars. So again, another example I can think of is coming from a school-based health center where we had a lunch program that we ran 3 days a week that offered a healthy meal to students, but then also provided them with some health education around that. It was a very high capacity and high cost program, but the kids loved it. And so really being creative and finding ways to be able to sustain that over time is really important. So making sure that you are partnering with your schools, that you're collaborating on things in terms of getting these programs up and running. So I will pass things on over to Velda.
Okay, can you hear me? I am Velda Keeney, and I'm with the Malvern School District in Malvern, Arkansas. We started our food pantry 3 years ago through grants, and we are now sustaining it. Our grant period is over, but our community has pitched in, and we are I won't say staffed because it's a limited staff, but we have a lot of support from our community. One of the things that we had to learn about and understand was the needs of our community. And so we had to dig pretty deep into our demographics and get a better understanding of why people maybe didn't come to the school-based health center to seek assistance, and how we could actually get food into their hands and get them the help they needed in a dignified manner. So we looked at our demographics. Our school district, we have approximately 1,800 students. And for our school-based health center, we actually have an enrollment of 1,100 students. So that's a big population, but that doesn't mean they come every single day, but they are enrolled for our services. Our city population is right around 11,000, and our county population is right at 33,000. So looking at the need here, we have 77% of our students enrolled in our free and reduced lunch program. And that is big in itself. But then we had parents who had no transportation. We had homeless students, again, with parents with no transportation, and they were roaming from place to place. Our county unemployment rate is 3.5 to 4.5%, which is close to our state unemployment rate of 3.3. That sounds like it's low, but when you take into consideration in our community that we have a population of people under the age of 65 that are on disability, which is 20.6% of our population. When you think about the workforce, and a lot of those people are parents, you see that there is a great need for this community. So figuring out what we needed to do, we extended from just saying, oh, you have to go to the school-based health clinic, but extended our services out into the schools with our school nurses, and our school counselors who were seeing these kids and seeing the needs that they had, and parents were more comfortable going to the counselor, the school counselors, and expressing the needs that they had. But then our next problem was, how did we get the food into their hands? So if you want to go to the next slide. So what did we do? Well, we had the on-site food pantry that people could come to the clinic. We were screening our patients and seeing their needs, but that wasn't enough. It wasn't reaching the people that we needed to reach completely. We found that some people needed us to deliver to their homes. Our counselors have pitched in, and we have car rider pickup where we have weekly grocery bags that we send home with the kids, where there's enough for them to have at least a couple breakfast, dinner with vegetables, fruit, and some type of protein, and some other items, so that they have enough for a few days. The counselors take the carts out, and they know which cars they go to, and they get them into the cars. Our bus drivers have even come on board, and they sometimes will identify kids for us as well, but they allow us to put the bags on their buses so that the kids don't have to carry the bags to the bus. They're already on the bus, and they get dropped off at their bus stop or their home with their bags, and it makes it to the house. We also found that we had emergency situations that would happen over weekends and holidays. And so we have a special phone line that goes directly to me that parents can contact 24 hours a day, 7 days a week. And I will help them as best I can to get the items that they need on weekends, holidays, summer break. We make those things available to them so that they have access to food. We don't want any child to go without having something to eat at any point in time. So we had to think out of the box to figure out how to get these items to our families. And we're still learning new ways to reach our populations. So I'm pleased to be able to present this, and I'm excited that we are able to continue on our program and sustain it without the grants. So thank you for letting me speak.
Thank you, Velda. Lexi, are you able to join and tell
Yeah.
us more about your work?
So my discussion will be kind of similar to Velda's. We were part of the 10 school-based health centers that Rebecca spoke about in Colorado. We're in a more urban setting, but in a pretty resource depleted area. About 90% of our students in the school district we serve qualify for free or reduced lunch and are below the federal poverty line. And we're seeing lines out around the corner down the block, 3 or 4 hour waits for the food banks in the area. So we utilize the funding from the No Hungry Kid grant to build a food pantry space, kind of order the supplies that we need to shelving and things like that. We also were able to use some of that funding to have a little bit of a FTE for one of our medical assistants to really work on building our partnerships with local community resources. And so some of those were able to provide us with emergency food boxes and other kind of leftover food that they had to stock our food pantry on kind of a pilot basis to make sure that it was utilized in the way that we thought before we moved forward with purchasing more food and looking for funds. Shocking and actually not surprising at all that it was utilized quite heavily, running out of food often. And so we looked to set up a private kind of fund for it, and we have organizations that are donating to that fund. So now we have, I think for this year, $24,000 to start purchasing food for our food pantry. And so we partnered with Food Bank of the Rockies, which is the major food bank for that supplies all of our community food resources as well. But becoming a hunger partner with them allows us to purchase food at a really low cost. So we're starting that process actually now. There's been some tricks that we're trying to figure out, like how do we pick up the food? It requires ordering a certain amount of pounds at one time. How do we get our staff out there to do it and run a school-based health center? So one of the things we were just figuring out yesterday was one of our community food resources is actually kind of a hub for Food Bank of the Rockies. So we're hoping our food can at least be delivered to their warehouse, which is much closer to our clinic. And then we can actually store some of the food there and then just pick up food as we need it from there. So definitely not the easiest thing. And on top of trying to provide the other school-based healthcare that we do, it is an added task that we're trying to continually figure out how to balance all of that. And then we're tracking our food pantry utilization and kind of deciding what we purchase based on what we're going through and what our youth health council, which is our youth involvement, says they're seeing the community need more of, or what people are saying they're not getting at the food bank. We also have some staff members that utilize food banks, so talking about what things they know go quickly at the food bank that people might not get access to if they had to wait in that long line. And then we're partnering with our local rec center and some of our community college students to start a nutrition class for families and youth. So not only how do they have access to the food, but how do they utilize that food, or how do they use that food in their home to cook some of those healthier meals. Yeah, so it's been definitely a learning process, but what we have learned is that having food in the clinic, especially when we're talking about it as kind of like a recipe for health, is helpful to have that example there in the clinic for people to be like, oh yeah, let me grab some canned vegetables to make my meal this evening.
I know, try to be mindful of time. Hi, I'm Kristen Matlack. I'm with the Institute for Hope, which is addresses health-related social needs at the Metro Health System in Cleveland, Ohio. So Metro Health is a safety net hospital system serving Cleveland and Cuyahoga County. And part of our system is a community and school health based division that includes our school health program. So we operate out of over 30 sites throughout Cuyahoga County, most of them in the city of Cleveland, but some in neighboring suburbs, where we have some on-site clinics, but also have mobile school health unit that travels around to provide services. So next slide, as part of our grant grantee process with No Kid Hungry and School-Based Health Alliance, we formed 3 youth advisory councils at 3 local area high schools. They were pretty spaced out throughout our service region to try to reach different diverse populations and schools with different needs. There were about 5 to 15 active youth at each school that chose to join the youth advisory councils. The YACs met monthly all of last year in the 23-24 school year during the school day, where we would provide a lunch, an education, and then engage them in providing feedback or working on a food access project. Each school implemented their own youth-led food access project. The photos you see here are also from a field trip we took to our local area food bank and to a food equity-based nutrition or community-based organization that operates their own farm and farmers market. Next slide. So these are photos of their food access projects. They were youth-led, and they all culminated last May. One school chose to run a Give Back to the Community Day where they put together hygiene kits, had food and family-friendly activities and community-based resources to provide to families at the school. Another did monthly school markets with their kickoff last May. So in collaboration with the Greater Cleveland Food Bank, 4,000 pounds of food arrives each month at the school, and a group of youth volunteers and just a couple staff members from our school-based health center pass out that food to 150 households in the community through a drive-through market. And the final school did a community garden cleanup and planted apple trees to try to create a sustainable, and there was an environmental focus for the youth involved in that one. Next slide. So some things we learned. Please check if you're interested in doing a youth advisory council. I highly recommend the toolkit that was developed by the School-Based Health Alliance. It was a great resource to us. If we had had more time, we would have wanted to do a longer application process to make sure there was a lot of buy-in with the members of the YAC, but also making sure that you have a school champion is imperative to its success. It becomes really hard, people have alluded to this, to do all your existing clinical work and add on this, and it becomes even harder if you're having to chase people to be a part of it. So the school that did the school markets has our strongest school-based health center presence. We are on site there, and we had our strongest champion on site, and so that council has continued for this school year despite not having additional funding. And then just that finding out what the youth are interested in. There's a lot of work that goes into having something truly be youth engaged and youth led. Lead with food and fun, provide them something, whether that's a stipend or a resume building or an opportunity to contribute to their community in a meaningful way, and be really realistic about your expectations and follow through for them, and they'll follow through for you.
Right, so as I mentioned, if you haven't had a moment and you want to type a question into the chat, we are running short on time. So as you can see, our poll has been launched. If you could take a couple minutes and answer those questions, that would be greatly appreciated. I am going to put a link in the chat for our toolkit that Kristen had mentioned. I don't know if we want to go to the next slide. So you can also scan the QR code here. This brings you to our toolkit, where you will find so many resources, and this is updated quarterly. And Kristen, I see that there is a question in the Q&A about the resource for starting the YACS. Were you referring to our youth development toolkit?
Yes, I was.
Okay,
Yeah, every time I need it, I just Google it on your website.
okay. I'll go ahead and put that in the link as well, or in the chat as well. And then I believe there may have been one more question. I know earlier there was a question about strategies for families living in food deserts. I think our panelists addressed that, but I don't know if there's anything else anybody wants to add as we wrap up. Take it away, Harper.
Alrighty, as people start to complete that poll and we're coming to the end of the hour here, just some quick closing announcements. We would love to see you at our annual conference in DC this year. It's from June 29th to July 1st, and that's our conference for the field and our youth conference called Be the Change Youth Training Program. We would love to see any of your students in DC as well. And speaking of your students, I am excited to announce that our Youth Advisory Council application is now open as of this morning. If you have any questions, you can check out our Youth Health Hub, and you can email our Youth Advisory Council email down there. And feel free to stay connected. We've got our social media linked here. We also have a bi-weekly digest that'll have updates and events and resources that we put out, pretty consistently here. So we would love to have you subscribe to that and stay updated on all of the cool things that we do at the School-Based Health Alliance. Awesome. Thank you all so much. I realize it's 3 o'clock on the dot here, so I will hold on and see people closing out that poll. But have a great rest of your day, everyone. And thank you so much for joining us.
Thanks, everyone.